it's so important that the patient has a good understanding of not just, like we've talked about, the stage of their cancer, but what symptoms they're having and if that can be attributed to their cancer. And then as we're discussing treatment recommendations, how I talk about adverse effects really depends on the therapy. So I kind of have my spiel for immunotherapy and obviously targeted therapies. It varies because they all have unique side effects. And then chemo is a whole separate thing. So it really depends on the patient. Sometimes we'll see a lung cancer patient who, maybe they are metastatic in stage 4 because they had a malignant effusion or contralateral lung involvement, but their disease burden is still reasonably low and they may feel quite well and not have too many side effects from their cancer. In contrast, sometimes people are having issues for months and months and they're going without a diagnosis and they're having bad pain. That's something that commonly is related to their cancer. If the cancer spreads to their bone or if they have a visceral met that's just in a bad spot, rubbing on a nerve. So, trying to talk through the symptoms they're having, if it's weight loss, anorexia, cachexia, weakness, and blaming the cancer for that and letting them know that their body's, increased metabolic demand because of the cancer and that it's normal for them to feel those things. And then I kind of tailor the, adverse event discussion based off what treatment they're getting. We give a lot of, if they don't have an actionable mutation, we give a lot of combined chemoimmunotherapy up front. There's several different regimens you can do. We frequently, for, adenocarcinoma, are doing carboplatin, pemetrexed, and pembrolizumab. And so that conversation, I separate it out and talk about the common side effects we see with chemotherapy, things for them to be looking for, like fatigue, potentially some nausea. I do tell them though, this treatment should not put you in the bed where you can't get out. You should not be vomiting uncontrollably. If so, then we're not doing something right. There are good antiemetic medications. We need to be knowing if you're having trouble. We'll talk about, things like constipation from platinum, tinnitus, or the cytopenias. And I try to reassure them that part of why we see them, the next week after they start chemo is to check their counts and to have that toxicity evaluation. And then we'll talk about immunotherapy, and I'll, basically tell them anything that ends in itis or that can be inflammatory is a potential side effect, and try to set the stage for, hypothyroidism, which happens most commonly. And I'll kind of go through high level what some of those symptoms could be like, but they can't get it all up front. It really is an ongoing conversation every time they come in. I do try to be specific when I'm kind of interrogating how they're doing. I don't just say, how are you feeling? I'll go point by point. How's your breathing? Have you noticed changes in your breathing? Tell me about your bowels. We love to talk about that. And so if you're specific, I find that I get better feedback from them rather than just asking, how have things been this week? And then obviously the targeted therapies, it's a very different discussion, based off of what drug they're going on. But I really enjoy that part of my job. I feel like patients are more successful when they have information up front about what's possible, so that they know what to be on the lookout for and can take a good inventory of how they're feeling before they start treatment so that we can really differentiate what's cancer and what's the therapy.
As an oncology nurse navigator, my main role is not to manage symptoms. However, my upfront teaching, a group of navigators, we created like a stoplight symptom management. And so green would be, it's okay to be fatigued, or it's okay to have a lack of appetite. In the yellow range, we would have something like, if you have diarrhea, twice in a day, that's okay. But take your medicine that's been prescribed for you. And then we have the red light. For instance, if they're having diarrhea, 8-9 times a day and they're on an immunotherapy, then you need to call your doctor. Or if you have a fever of 100.5, you need to call your doctor. And then at the bottom, we write, very large, the medical oncologist number. So I don't specifically manage symptoms as an oncology nurse navigator, but I give my patients tools and I encourage them to put this one-page stoplight thing on their refrigerator so that they can look at it and go, oh, wait, this is something I have to call my oncologist about.